Who's a good candidate for facelift?
Well, facelift is a general term. That's something I have problem with some of the patients because the facelift patients could come with problems with the upper face. I mean, patient could understand facelift is something like this. And the other patient would be describing facelift something like, neck lift. And the other one would be doing this one, so including the mid-face. So the general terms about facelift is, first of all, in the first interview with the patient, should be clarified. So the ideal patient would be the patient who could sort of point out exactly what bothers her with aging. I mean, ideal patient would be saying that, for instance, I feel like my mid-face getting sort of gouged. Sort of I'm losing, the fullness here. Or the other one would be talking about the jowl here, saying that, in the past I have a very clear jawline, but nowadays I just feel that, this something fullness here is breaking the contour of my face and neck. So depending on what you're gonna do, the ideal patient, as I said, to me, is the one exactly telling me what happened, with the aging on that particular face.
Is there an age limit for facelift?
Not at all. The oldest patient I operated on was about 78, but I remember patients I did facelift when she was about 30 something, 30 at the beginning of 30s.
So how the facelift procedure is performed?
Well, it's a bit difficult question because there are almost not hundreds but tens of different facelift techniques. But principally, I could say that if you're just relying on the skin tightening, as majority of the patients would think, because they would think facelift is something like pulling the skin up and stitching it there. This is not, facelift. This is the facelift in 1920s. Today we know that, because of the stretchability, elasticity of the skin, anything you do with the skin only would not be long-lived, would not be reliable, and would not be looking natural. So I know that there are different techniques, endoscopic techniques, as I say, again, skin tightening, etc. But any surgery on the face should be something to be the SMAS layer. SMAS layer is the layer under the skin. So this is the area, this is the anatomical structure that you can rely on in terms of putting out or fixing.
Where will be the scars from temple lift, mid-facelift and neck lift?
Well, again, depending on the techniques, but if I speak of my own techniques, the temple lift incision in my patients is about 3.5 centimeter within the temples, within the hairlines. For the mid-facelift, I could just roughly say that I'm using the lower blepharoplasty incision, just halfway around the lower eyelid and about 1.5 centimeter on the smiling crease here. On the in the full facelift operations, I know that there's some people doing the incision all around the ears and going back, but in the majority of the patients, my incision goes, the maximum is somewhere around here, but I'm trying to, depending on the neck problem, my incision will be going around the ear. I mean, any incision, behind the ear is actually addressing the problem on the neck. So it's not part of the ordinary facelift surgeries.
And how long is the recovery period after the procedure?
Well, in the neck area, I think maximum 10 days. On the temple, again, about 10 days. But the mid-face would take a little bit longer, say 2 or 3 weeks.
Okay. And we know that you worked in Australia and developed your own technique for facelift?
Well, I start with the Mr. Mendelssohn's technique. That's another, one of the major SMAS techniques. It's not as extensive as the other techniques. But I think it's the major advantage of Mr. Mendelssohn's technique is both effective, less traumatic, less extensive, and addressing the mid-face as well. That's the way that I started. And today, if I can call my own technique, I would just say that I'm sort of addressing the mid-face problems, not as part of the Mendelssohn's facelift techniques, but I'm just trying to use another access to the mid-face, and I'm doing mid-face first, and then I'm sort of handling the rest of the face, as I said, with the smash elevation techniques of the Mr. Mendelssohn's technique.
Eyelid'e geçiyoruz. Can you briefly explain how is lower and upper eyelid surgery is performed?
Eyelid surgery in the upper eyelid is more straightforward and more problem-free because you're dealing with the skin, and the maximum is about the fat on the medial side. Medial side means right here. As you see, when I push my eye globe, you will see that there's something bulging here. As you see here.
Yeah.
That is the fat all around our eyes. Our eyes are sort of, ball, and it's in a bone cavity, and to keep it there rather than move it around, the nature has put some fats all around it. Something like you're sitting, watching TV in the evening, and you have pillows all around you for your comfort. And here, both the comfort and the safety of the ball, and for the muscles to work for different reasons, but somehow our eyeball has been surrounded by the fat tissues, fat pads. In the upper eyelid and in the lower eyelid, but when we get older, or somehow in the light-skinned people, fair-skinned people, because the support tissues are not strong enough, so these fat pads start sort of coming forward. If you look at my eyes, when I do this, you see that something is bulging out under my lower eyelid as well. That's, in my case, due to aging. So this, at some point, will not be, like this, but rather more advanced. That means even if I don't push my eye globe, you would see these fat pads sort of bulging out. So in the upper eyelid, the majority of the problem is about skin. Somehow the skin is there, so thin and so due to sunlight and etc. It would be sort of aging more than anywhere else. So even with the fat tissue in the upper eyelid, it's something easier. Easier means the possibility of having any sort of postoperative complication in terms of the healing process is not something we see common. But in the lower eyelid, it's always a challenge. Even if you do the as minor surgery as possible in the lower eyelid, because the support tissues of the lower eyelid is not strong enough as comparing to the upper eyelid. So anything you do in the lower eyelid, it will raise the question of the extropion. That means pulling the eyelid off the globe. So this, problem is always at the door. Anytime could just, knock the door. So whatever you do on the lower eyelid, you should do some sort of counterpexy. That means, fixing the lower eyelid here, as I do, myself, so that, any sort of complication about extropion would be sort of minimal.
And how long is the recovery period after the surgery?
Well, comparing to other surgeries, I think in ordinary cases, if you're just doing the blepharoplasty, all you need is just 4 or 5 days.
Can eyelid surgery be performed with facelift surgery at the same time?
Well, we usually do, because otherwise that will be looking weird. I mean, having a facelift here, sort of, restoring the youth in the lower part, but the actual, most quickly aging part of your face is actually the upper face. So actually, you should be starting, thinking about doing something about your face, starting with the upper face.
And is eyelid surgery performed under general or local anesthesia?
Depending on what you're going to do. For instance, in the lower eyelid surgery, if you do like I do in transconjunctival surgery, I would rather go for the sedation or general anesthesia. But for the only upper blepharoplasty surgery, general anesthesia would be too much. So usually local anesthesia would be enough.
Okay.
Good.